Good morning, Lake Providence family and friends. Dr. Linda Plummer Ward here with a health ministry moment. Today we'll discuss COVID-19, but then we're going to veer off a little bit to talk about colorectal cancer. COVID-19 continues to shine a light on essential workers who are often required to work, sometimes without protective equipment and with no hazard pay. They risk health and life to serve us. And it is not only their lives, but their families. If there are essential workers listening, or if you know of an essential worker, join me in thanking them for all they do to keep our community functioning and safe during this pandemic. We continue to pray for the safety and good health of you and your families. For many of us, Labor Day is a time to take the day off. But remember, the SARS-CoV-2 strain of coronavirus that causes COVID-19, it's not going to take a day off. So let's continue our safe practices to slow the spread and avoid a surge following this holiday weekend, as we've seen before with Memorial Day and July 4th. Wear masks, practice social distancing, wash hands frequently, cover cough and sneeze, avoid crowds, avoid touching eyes, nose, mouth, and stay home when sick. Remember, outdoor activities are safer than indoor activities. Now let's talk colorectal cancer for a moment. Colorectal cancer is one of the leading causes of cancer and death in the United States. It was recently brought to the forefront by the death of 43-year-old African-American actor Chadwick Boseman. African Americans are diagnosed more frequently and are more likely to die from colorectal cancer. That's not a surprise, huh? It was a disease mostly of those over 50, so we didn't really worry about getting a colonoscopy until we were 50. Now, younger people, even in the late 20s and 30s, are affected. Colonoscopies start at age 45 now, or earlier, if there is increased risk for the disease. What are the symptoms? Blood in the stool, change in the caliber of the stool such that you're getting smaller, thinner stools, unexplained abdominal pain, and weight loss without trying. These symptoms usually will be persistent. They won't come and go, but they'll be persistent and something that you'll need to take notice of. People with inflammatory bowel diseases like ulcerative colitis are also at increased risk for colon cancer. Colorectal cancer risk factors that can be changed: being overweight or obese, not being physically active, certain types of diets, such as those with high content of red meats like beef, pork, lamb, and liver, cooking meats at very high temperatures, such as frying, boiling, and grilling. This can produce cancer-causing chemicals in the meat. Low levels of vitamin D, smoking, and moderate to heavy alcohol use. Colorectal risk factors that we cannot change include older age, history of polyps or adenomas, and adenomas are the types of polyps that cause cancer or become cancerous. History of inflammatory bowel disease, as we said, ulcerative colitis or Crohn's disease. A family history of colorectal cancer or polyps. Racial and ethnic backgrounds, such as being African American, and type 2 diabetes. Colorectal cancer screening includes a stool specimen, a colonoscopy, now starting at age 45, and every 10 years after that, depending on family history, genetic screening, and colonoscopy findings. And this is according to American Cancer Society. So stool specimen, where we look for blood that you can't see, a colonoscopy, which allows for direct visualization by a gastroenterologist, and genetic screening. So there is much more to be aware of regarding colorectal cancer. The Lake Providence Health Ministry invites you to our Facebook page so that you might organize a watch party with family and friends. We've uploaded a video from blackdoctor.org that you will find that you can watch together. It lasts about an hour, and it's on colorectal cancer. You will also find details for our mini-series webinar on colorectal cancer in the very near future. So watch our Facebook page for more details. We pray that you have an enjoyable Labor Day weekend. Continue to be safe, be healthy, and stay prayed up.